Hello, my name is Elizabeth Raya and I will be talking about the signs and symptoms of stroke. Many of you may ask, why did that young individual get a stroke? What are the risk factors? What are the signs? Am I at risk for a stroke? According to the American Heart Association 2020, stroke kills more than 142 thousand a year. That's one in every 19th death. What is a stroke? A stroke is sometimes called a brain attack, and it occurs when something blocks blood supply to part of the brain, or when a blood vessel in the brain bursts. In either case, parts of the brain become damaged or die. A stroke can cause a lasting brain damage, long-term disability, or even death. It's important to note the signs and symptoms of stroke, which can include sudden numbness or weakness of the face, arm, or leg, especially on one side of the body. Sudden confusion, trouble speaking or understanding, sudden trouble seeing in one or both eyes, sudden headaches with no known cause. Sometimes they would describe it as their worst headache of their life. This is commonly seen with hemorrhagic strokes, sudden dizziness, unsteadiness, or lack of coordination. There's uncontrollable risk factors and manageable risk factors. Some uncontrollable risk factors include age, race, gender, family history, prior history of stroke, TIA, or heart attack. There's manageable risk factors, which consist of high blood pressure, high cholesterol, diabetes, peripheral artery disease, smoking, lack of physical activity, and obesity. So what could you do to prevent a stroke? Eat a healthy diet, low in sodium, with plenty of fruits and vegetables and water. Avoid secondhand smoke and do not smoke. Limit alcohol use, maintain a healthy weight, be physically active, and manage your health conditions. A way to remember the risk factors of strokes is strokes happen. S standing for smoking. T for thinners, specifically blood thinners. If you get the blood too thin, it's a risk for those blood vessels in the vein to bleed. R for rhythm changes. Be aware of AFib, which the heart is not contracting properly and can produce a blood clot, and it could travel to the brain. O for oral contraceptives. K for kin, for family history. That makes you higher risk for a stroke. E for excessive weight. S for senior citizen. As we age, we're also higher risk for a stroke. H for hypertension. A for atherosclerosis. P for physical inactivity. P for previous TIA. If you have a history of this, you're at higher risk. E for elevated glucose, like for the diabetes patients. And for aneurysm of the brain. Types of stroke. There's an ischemic stroke, which occurs when blood clots or other particles block the blood vessels to the brain. Fatty deposits called plaque can also cause blockages by building up in the blood vessels. The other form is hemorrhagic stroke, which occurs when blood vessels burst in the brain, blood builds up, and damages surrounding the brain tissue. Then there's the transient ischemic attack, which is also known as a mini stroke. This one reflects a temporary disturbance in the cerebral blood flow, which reverses before an actual infarction occurs. How to diagnose a stroke? Your doctor can perform several tests to diagnose a stroke, such as brain imaging, including an MRI, a CAT scan, or test of the brain electrical activity and blood flow test. So, when you arrive to the emergency department, right away, if you have any signs and symptoms of stroke, you are directed to the CAT scan to determine and detect if you have an ischemic stroke, hemorrhagic stroke, or if it was just a mini stroke. That's the first thing that they do and draw labs. Treatment. At the hospital, health professionals will ask about your medical history and about the time your symptoms started. Time is very important. The brain scans will show what type of stroke you had. If you get to the hospital within 3 hours of the first symptom of an ischemic stroke, you may get a type of medication called a thrombolytic, which helps to break up blood clots. This is called TPA. TPA improves a chance of recovering from a stroke. Studies have shown that patients with ischemic stroke who receive TPA are more likely to recover fully or have less disability than patients who do not receive this drug. Patients treated with TPA are also less likely to need long-term care in a nursing home. Unfortunately, many stroke victims don't get to the hospital in time for TPA treatment. This is why it's so important to recognize the signs and symptoms of stroke right away and call 911. This thrombolytic is only used for ischemic strokes. Stroke education is very important due to it being the fifth leading cause of death in the United States. Many individuals lack education and delay care of stroke when a situation arises. There are two main types of stroke, which are the ischemic stroke and the hemorrhagic. Then there's the transient ischemic attack, or it's also known as the mini stroke. Knowing the signs and symptoms of stroke helps the individual get the proper care on time. In the Rio Grande Valley, we have majority of the Hispanics that are obese, have high blood pressure, high cholesterol, and diabetes, which are some of the leading factors of stroke. Individuals need to start by changing the modifiable risk factors by changing their diet and incorporating exercise to their daily routine. There are also unmodifiable factors for stroke, which include age, gender, race, and family history. The aim for individuals to know the risk factors, signs and symptoms of stroke, to help the patient get the proper care in time. Effects of stroke. The brain is an extremely complex organ that controls various body functions. If a stroke occurs and blood flow can't reach the region that controls a particular body function, that part of the body won't work as it should. If the stroke occurs toward the back of the brain, for instance, it's likely that some disability involving vision will result. The effects of a stroke depend primarily on the location of the obstruction and the extent of the brain tissue affected. The effects of a stroke depend on several factors, including the location of the obstruction and how much brain tissue is affected. However, because one side of the brain controls the opposite side of the body, a stroke affecting the one side will result in neurological complications on the side of the body it affects. Left hemisphere. If the stroke occurs on the left side of the brain, the right side of the body will be affected, producing some or all of the following: paralysis on the right side of the body, speech or language problems, slow, cautious behavioral style, or memory loss. Right hemisphere. If the stroke occurs on the right side of the brain, the left side of the body will be affected, producing some or all of the following: paralysis on the left side of the body, vision problems, quick, and inquisitive behavioral styles, and memory loss. By learning and sharing the FAST warning signs, you just might save a life. FAST stands for face drooping, arm weakness, speech difficulty, and time.
I consent to be in the following video.
I consent to be in the following video and for it to be used for educational purposes.
How was work yesterday?
It was good. How was your day?
It's been good, but I've been having some headaches lately. I already had them for like the past 2 days now.
We need to call your doctor so you can get it checked.
Yeah, I'll have to call him to make an appointment.
Mm-hmm.
So what are we gonna have for dinner tonight?
I was thinking of making some chicken Alfredo.
Some chicken. Oh, that sounds good. Oh, I forgot. We don't have pasta.
Oh, okay. Then I'll just go to the store. So I'm gonna go to the store already. So if you need anything, just call me.
Okay. Oh, these headaches. I think I'm gonna go sit down for a bit. Oh. I feel good. I feel good. Hey, I don't feel that good. I need to come back. Yeah, I feel good.
Hello? Are you okay? Why are you talking like that? I'm gonna go inside right now.
Oh my gosh,
Are you okay?
I need to call 911. I think you're having a stroke. I need an ambulance. I think my husband is having a stroke. He had a headache about an hour ago and he called me about 10 minutes ago and he had slurred speech. I couldn't really understand him. Yes, I came inside and then I saw that his arms were really weak. He couldn't move his left side.
So let's look back at the video. Remember FAST stands for face drooping, arm weakness, speech, and time. So ask yourself, does one side of the face droop or is it numb? You could also ask the person to smile. Is the person's smile uneven? Arm weakness. Is one arm weak or numb? It could also be the leg or both. It could be the right side or the left side. You could ask the person to raise both arms. Does one arm drift? So you could also do this with the legs, not only with the arms, and see if one leg is weaker than the other one, or sometimes they're not able to raise neither. Speech.
Hey, I don't feel that good. I need to come back.
Is the speech slurred? Is the person unable to speak? Or is it hard for you to understand? You can also ask the person to repeat a simple sentence or a word. Is it slurring? And then time. Time is very important.
I need to call 911. I think you're having a stroke.
And remember, call 911 at the first sign and symptom of stroke so you could be evaluated and receive treatment in time. Remember, FAST for facial drooping, arm weakness, speech difficulty, and time.